You know, sometimes during the therapy, the pressure change a little bit. Yes, the pressure changes a little bit. If I want to reset the alarms, how do I reset the alarm limits? You see here the alarm limits are fixed, right? Maybe it will come outside in an alarm. How to change it? Plus, minus. Oop, do you see they go open again? And then when it's stable, they close again.
Is it for only the arterial pressure or for both?
Both, look, both go up. Did you see? Look, there is the venous pressures and there is the arterial pressures. Plus, minus. You see they open up to reset. No, one. Okay, that resets the alarms for a while and then brings them back. They are more stable. Okay. Wait. We are step by step. I go through all the problems. Arterial pump, right? Heparin pump. Not really issues there. Okay, now we get to PBE. I want to show you PBE if there is a clot, the problem. Okay, so usually the clot will be here, right? So I'm going to simulate a clot for you, okay? I'm going to simulate a clot. PBE alarm. What must the nurse do when there is a PBE alarm? Flush with saline. Yeah? How much saline are you giving when you flush? You flush 400 for flushing. Oh, it's too much. 200. How you know? You check here?
No.
How you?
You set it.
Yeah. You set it. Oh, good. If you set it, this is good. You know this button. You use the button. Okay, great. I set it to 100 and I press the start button. Automatically, I must just close the arterial, open up the saline. It will flush for 100, and when it's finished, it will say, "Hey, I'm finished." Close saline, open arterial. You know it now.
This setting in particular is for
Flushing, yes.
in case there is a clot.
Yes.
So it goes in line with if the saline here is connected to this port.
Yes, exactly.
So if we input all of this, it will
Yes.
make sense.
Buttons? You see the flush button, the blood line, and we put saline. Okay.
That means
What is fantastic about this? It will tell you how much you are flushing. Maybe I want to stop the flush. It's enough. I stop. I only flush 50. Or maybe I flush again 100. When I'm finished, it will tell you the total infused volume. I put 350. Ooh. What am I going to do? Go to the UF and put.
I have a question.
Yes.
Regarding the float back in case PBA alarms, are we to lock the arterial for the float back
Yes.
from the artery?
Yes, you lock arterial, open up saline,
Line from there.
press start. The blood pump runs, blood pump stop. Close saline, open arterial,
Continue.
then continue.
Press the start.
Yeah, okay, we don't have to do it now, but because it's not very.
Open the arterial part from the line.
Yes.
Lock.
Okay, are you happy with PBE?
Yes.
PBE is super if you are trying to get the best heparin for your patient. Because, you know the problem with the heparin. How much heparin? How much heparin? Oh, I give too much. Now you are finished with the therapy, you wait 20 minutes because the patient is bleeding and bleeding and bleeding. How do we do this? How do we prevent this? You go to the heparin stop time. Normally you put 30 minutes, right?
Yes.
Maybe you must put 45 minutes. Do you want to put 45 minutes? No, I'm scared because I think the patient will clot. I don't want to put 45 minutes. Don't be scared. Use PBE. The machine will give you an alarm if it will clot. So make it 45 minutes, and then the machine will alarm you before it clots, so you are safe. The machine will check for you.
I usually do 1 hour 20 minutes.
Yeah, but maybe you look. It's different from patient to patient, right?
Yes.
Some patients are perfect with 30 minutes. Some patients need 45 minutes. Some patients need 10 minutes. It's different. Okay, good. This is called heparin optimization. Good. Let's go on. Let's go on. So now we come to the venous side. Do you sometimes have little clots here? Yeah. If this level is too low, and the blood falls and it makes bubbles, then you will get little clots here. These little bubbles, micro bubbles, go through the safety air detector. And if the safety air detector sees micro bubbles, it will also give you an alarm. So if you are getting safety air detector alarms, make the level higher. Okay, the optimal position is 1 centimeter from the top. This is the optimum position, 1 centimeter from the top. Okay, if you are doing dialysis and during dialysis the level is coming up, where is the problem? The level come up slowly, yes. No, this level here, slowly come up. Where is the problem?
Probably
Maybe it's not tight, or if the nurses put too much force, they crack the little blue connector, and then there is an air bubble. You must take it to the technician. The technician must change the blue connector and the filter on the inside. Okay, only if it goes up slowly. Call the technician because we must change this blue coupling, this blue connector here. Okay, we change the lower lock connector. It's a leakage. Good. If you are in disinfection, right, and the machine gives you blood leak, does that make sense? Doesn't make sense. The machine is seeing blood in disinfection. Where is this alarm coming from? Here. You must clean the sensor. How to clean? Just hot water. Hot water. Don't go clean, go clean. Good. Hot water, yes. Hot water. You can put a little bit of soap, it's okay? Yeah, soap. Hot water and soap, yes. If you want, you say you use spirits. What spirit are you using?
Methylated spirit.
How much percent?
Just a single drop.
No, percent is actually percentage of
Okay, the alcohol.
Yes. Please.
Some are 0.5, some are 0.5, some are
0.05%.
This is chlorine. No, this is chlorine. It's not chlorine.
Let's check.
Ethanol, yes. Ethanol, not more than 70%. 70% maximum. How much? Please don't use that. It's not good. It's not good. Not more than 70%. Do you have a different milliseptol or something else? Hypochlorite. Chlorine. It's too strong.
There are some that are not that high.
Yeah.
Lower, yes.
Less than 70%. The problem with that one is, if you use that high concentrated spirits and you put it on the sensor will go like a white color.
Yes.
And then you break it. You have to replace it because it cannot see anymore.
Yeah, it will damage it.
It will damage it. So for now, just use hot water and soap. Just clean it. It's better. If you want to disinfect afterwards, but also, are you cleaning the screen with that?
No.
Please don't clean the screen with that. You're going to get white screens. Please no. Okay. Also here, when you're cleaning and you spray on the cloth and you can clean it, then it will be safe. If you don't do this, here you will start to rust. It will start to rust here at the bottom and damage the boards inside. Yeah. Please don't. If you can find hypochlorite, the maximum hypochlorite 0.1%. 0.1%. Okay. Good. this is all the biggest problems that you have on the blood side. Do you have other blood side alarms? Anything? If you think of something, let me know. Okay.
Sometimes what happens when during the therapy mode, it flashes blood leak 0 something, less than 0 something. During therapy, sometimes it shows yellow. Then sorry, this place it shows blood leak less than 0 point something.
Yes. This is the blood leak. This must be 0, 0, 0. We must
During
check.
therapy mode.
Yeah, it must be 0 because there is no blood.
No, I mean when there is blood. Sometimes maybe a patient's on the machine.
Okay. There are two sensors. This is the red detector, and inside the machine we have a blood leak detector. Okay. So the red detector is just to see if there is a patient connected or not. And the blood leak, this one, is inside the machine. Yeah.
So what causes it? Because of dialysis, it flashes sometimes.
Usually it means the sensor is dirty. This is supposed to be 0. I think there is some dirt inside the machine. Probably because the water quality is not good. For this machine, I'm going to change the citric acid from 120 milliliter to 150 milliliter because I want more cleaning. Yeah, it must be stronger. Okay. Good. Are you okay with the blood side? Let's check some other sides. I don't know if you've seen this alarm. Everything looks normal, no problem. TMP, okay, that's a little bit strange. No problem, okay, it goes away. Oh, concentration mixing ratio. Huh? Why?
He used to write it.
My thoughts.
Yeah, machine.
Final connectivity limit. Bicarbonate connectivity. What is it?
This one, whenever you change the acid, sometimes you have complete like this, and this will come up.
Now what is that? What am I doing here? Did you see what I did? I clamped the flow. So we don't call it flow alarms. We call it membrane movement alarms. We call it bicarbonate. There are many different faults that can happen from this error. So the main thing that I did was I blocked the flow to the dialyzer. Okay. And now we need to find out what causes this problem. Look here, I can see the connectivity is not right. It's not right. It needs to stabilize first. Okay. What is the main problem to block the dialysate flow? The main culprit, the big bad guy, is the filter behind the machine. The pyrogen filter. The pyrogen filter is blocked. Why does the pyrogen filter block? If the disinfection is not good. Okay. All these types of alarms can come from the filter on the back. Yes. What I simulated now, I simulated a blocked filter. So do you see all the problems we are getting from a blocked filter? Okay.
It shows when we have those signs, check on the pyrogen.
Yeah, it's not always the filter, but most of the time it's the filter that's not being cleaned properly. If I do a thermal disinfection, there is no citric acid, the filter will block. This is why I don't like a thermal disinfection. Okay. If the filter is old, how many treatments can I do with the filter? 150 treatments.
Yes. No, not there.
You can't see in disinfection mode. You can see how many. I can do 150 treatments. Then I must replace the filter. All these things. If the filter is giving me problems, this is the problem that I get. Okay, the biggest one is membrane movement alarm. For the very technical guys. For the very technical guys, how do I spot the problem? Look at the pump speeds, FPE and FPA. These are the flow pumps inside the machine. FPE and FPA are pushing against each other. They must both be running at the same speed, almost the same. 835, 809. This is very good. They are both running at a nice speed. If I create problems, look, one of the pump speeds. Which one is shoot up? Did you see?
1 million.
FPA.
Went higher.
Yes, did you see? Look again, look again.
Yeah, 920.
No, it's 25.
It's 25.
26, 29, 24.
Can you see?
Yeah.
Okay. So how do I confirm that it is the filter at the back? I check FPA. If FPA goes up, it's the filter. Check the filter. Okay. Sometimes the cleaning lady comes by, right? And the cleaning lady is cleaning. I want to move the machine. Move the machine. And I push the machine over the drain. Look at the pump. Can you press the spanner? Look at FPE. Okay. What is the pump speed of FPE now? 800 what?
829.
829. Okay, I'm gonna clamp. I'm gonna clamp now. FPE.
FP.
829.
It's still 29. You can touch it.
FPE. What is happening?
It's still 829. No movement. But FPA is being ahead. 1,000.
You see? Again, same problem. So FPA is the patient side. FPE is the drain side. You know, sometimes after the disinfection, the tube goes like this. On the, there from the way you connect it. What is the alarm I will get? This FPE alarm. So you can check it. Okay.
So movement on the drain also in fact.
Yes. Okay. There are always two sides, the patient side and the drain side. FPE is for the drain, FPA is for the patient
For the
side.
patient side, I notice if maybe there is a side movement on it, sometimes it shows water alarm.
Yeah, it can be connectivity alarm, it can be mixing ratio alarm, it can be all these types of things because I'm disturbing the flow. All right. Membrane movement alarm, you will also hear a lot. What else can I show you? Any other alarms? Maybe you are getting other alarms? You can think. I think these are the major. Safety air detector. I am afraid it is because of the bloodlines you are using. This bloodline is very thin. It's too thin. Please don't spray some fluid there to make it connect better. This does not work. This is for Fresenius. You can do it on the Fresenius machine. Because
you can't do that.
yeah, they stopped saying it.
Yes, you can't.
But it comes from a very old tradition of the nurses. Remember when we had the big sensors and the chamber, and then they would squirt it because you squeeze the chamber in, make it nice and tight. This is very old. And then the nurses would spray some juice. Please don't do this anymore. Well, you will just make it worse.
So during the therapy, is this the best way to let the dialysis?
Yes. Why do we put it like this? During priming, we are pushing arterial up, and during use of dialysis, we are pushing the dialysis fluid up, because the fluid goes like this. Okay. So before we do therapy, we turn it around.
That's what we do, like first,
You prime with blue on the top, and you run therapy with red on top.
What we used to do is this. After priming, I wanted to connect the patient. We used to let the blood to go before turning.
Okay.
Right?
Yeah. No. Do the priming like this, and when it says it wants the couplings, turn it. This is the moment to turn now.
Thank you very much.